One of the interesting things that is really happening in cataract surgery right now is the idea of giving people good eyesight without the need for glasses after surgery. So if you're between the ages of 50 and 100, you may be developing cataracts. In fact, the average age for cataract surgery is about 70, but a lot of people get cataracts earlier than that, and some can put up with the bad vision for longer and delay. But about the time of being 70 years old, most people start to notice some degradation in vision. You may go see your doctor, and one of the new options that you have now is to pay for extra services that will allow you to see without glasses after surgery. It's more demanding for the doctor to try to get right on target so your vision is 20/20 without the need for any glasses. It's more demanding on the surgeon, and there's new technology to help. One of those is this company right behind us here called WaveTech. Let's go a little closer. This is a device that attaches to the operating microscope. So what you see over here, this is what it looks like in the operating room when you're having eye surgery. There's a microscope like this right here. And what this device does is it attaches to the bottom of the microscope, and it actually measures the refraction in your eye during surgery. So, you know, when you go to the eye doctor, for example, you sit down in the chair and they put that big thing in front of your eyes and they turn the dials, which is better, 1 or 2, right? Well, after they get to the end point, which is where your best vision is, and you say, yeah, that's good, that's your refraction. That's the measurement of your refractive error, how much your eyes are off from perfect, and that's what you need in your glasses, right? So this device measures that actually while you're lying down in the operating room. And that way the doctor can get a better idea of what lens would be the perfect implant for you. You may not realize it that everyone who has cataract surgery gets an implanted lens. This has been going on since 1949. The first lens implant was a long time ago, and things have gotten a lot better since then. In fact, now we have lenses that not only correct your nearsightedness or your farsightedness, they also correct astigmatism, and they're also lenses that give you distance and near vision without glasses. So there's all kinds of different possibilities. But this device, it's called the Aura, O-R-A, that goes on the bottom of the microscope can really help because it measures the eye during surgery and gives the doctor another piece of information on which is the right power of implant to put in the eye, or just how to line up a lens that corrects astigmatism so it really improves your vision. I'd have to say the downside to this is it's really an art. It's not just you push a button and you get the refraction. You've got to really work with the patient who's lying down on the operating table, and if you've ever been on a operating table, you know you're not exactly at your best. So all you have to do, though, is focus on a little light, but still, if you're sedated, that can be difficult. Plus, the surface of the eye has to be just right, bathed in irrigation fluid. There can't be any pressure on the eye. There's a lot of factors that go into getting an accurate measurement with this, so there's some art to it. And there's a learning curve for doctors to get up to speed to use it just right. But once they do, it can really help improve the results. Let's go look at some other stuff.